Austria, the screening program is from the government improved since 2014, and we have now the second run of the screening program. And every woman is invited in 2 years in 2 years with a letter, and they can decide where to go. They see many assessment centers on the background, and they can take part. They just do a phone call to the assessment center or to a screening center and make an appointment. So it's quite easy for them. I just go through a bit quick. In Austria there are about 5,000 cancers a year, and this is the most cancer for women in Austria. And within 1,000 screening patients, 24 women get a call back from the screening, and 6 women suffers with cancer, and we should find them as early as possible. You can decide at home if you want to go for early detection cancer, and when you find abnormal results, don't worry, maybe you're just in the 24 of the women who have a rescreen in the assessment center, and only in 6 patients we will find some tumors. But as early you find the tumor, it's better for living long. So screening program makes sense. But even in Austria, we re-evaluated the screening program, and only 50% of the screening population takes part in the screening program, and this is a shame, and we try to improve it, but it's a long way. Even in Austria, it's very easy to take part in the screening program, but women doesn't like, and we don't know the reasons why. We found out that in cities, screening is more popular, but in villages and smaller towns, you have only a screening. Only about 30 or 40% of the screening population takes part of, and this is really terrible, because European guidelines say that you have to have a 70% of screening population take part in the screening program, that it can work properly. And for the rescreen, after the 2 years, it should be about 75%, and we are quite far away. And this is really terrible. Maybe we will lose screening program from government when we can't improve the percentage, because it's quite expensive for the government, all the letters and all the screening units that take part in the program. So it's quite hard, and we try to do different things. So in this program now the surgeons and the gynecologists and the physicians are included. They get money for talking to women visiting in their practice. They get about 20 euro for talking and inviting them to the screening program. This is now what we think to improve the percentage of screening population, and we do further information, and we go into schools and we do advertising, and we see it's slightly going, the number is slightly going up. That's it's a shame, yeah. And in the screening program, it's in addition to mammography and ultrasound, examination is also included in screening program, and the participation in the early detection program is not mandatory. And maybe this is also a point, because when you have to go, like it is in Norway, they get a letter, and most of the women take part in the screening program is much better, and we don't know how to really improve it better. In our country, it's now possible to take part at the age of 40. You can come in the screening program with a phone call, and even if you're older than 75, it is possible to take part in the screening program. They have to do a phone call and just or an email to the invitation center, and then you get the invitation every 2 years. So it's very easy, but it is not working. Yeah. When we do the screening, we have a BIRADs classification. I hope you know the BIRADs classification, and BIRADs is very important for communication between radiologists and clinical partners all over the world. BIRADs is an international code, and each report in the BIRADs imaging has a BIRADs classification. For instance, also in MRI you have to do a BIRADs, in mammography you have to do a BIRADs, and this is also in CSM you should have a BIRADs classification, and BIRADs 4 and 5 must end in biopsy so that you don't miss an early cancer. And the BIRADs category helps to understand the report and the further management. So what does BIRADs 0 mean? BIRADs 0 mean an additional imaging to prior examination is necessary. You have to do a further MRI or a CSM or an ultrasound. BIRADs 1 is negative. Likelihood of cancer is about 0%. Also BIRADs 2 is benign. Routine follow-up in 2 years is normal. BIRADs 3 says properly benign with a likelihood of cancer larger than 0% but smaller than 2%. So when you do a BIRADs 3, you think that 98% of your BIRADs 3 lesions doesn't suffer with cancer. But we do